Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees, and Jules for right now. I want to finish going over that Henry Garrido letter from yesterday. It is long, and we want to try to keep going through it just so you understand all of the false points that he made in here. So yesterday, we got through the first part, the first two paragraphs, literally. And so still obviously on page one, we are going to try to cover the last two paragraphs and then maybe go into page two. So everywhere you see yellow is what we highlighted as what we've determined to be false. And then we marked up in red to either question, the veracity of some of the things that he is saying or provide the points. So he says the Municipal Labor Committee and the city have outlined a strategy to reduce the cost of healthcare by eliminating inefficiencies and addressing price gouging by healthcare providers. So now, let's just briefly talk about that, because the inefficiency is not really for the union or the mayor or labor relations to determine. That is really up to your doctor to tell you what you need. When they are putting in prior authorizations to limit your healthcare, they're determining that to be an inefficiency. Well, if your doctor says you need a test or you need a surgery or you need a procedure, then that should be up to your doctor, not Michael Mulgrew, Henry Garrido, Harry Nispoli, or Mayor Adams. Unfortunately, they are identifying that, in their opinion, as an inefficiency, as if you are overutilizing a service, which is costing the city money. We do not believe that. Your doctor should be in charge of your health care, and we believe your doctor should be making those decisions, especially those of us who are in medicine. I don't really know about the qualifications of Henry, Harry, Michael, or Mayor Adams, that I would want to put my life in their hands. So that said, I think it's important that you all recognize that that is not an inefficiency when your doctor is expressing a need that he believes or she believes that you need. Price gouging by healthcare providers. This is another issue. Yes, while it has been identified under certain circumstances, there are different hospitals charge different prices based on region, based on service, based on the education of their physicians, the qualifications of their physicians, and that is really up to them to determine what their pricing is. If the pricing is so far outlandish, there was one point in about 1996 when the Governor Pataki had rescinded it was a law that allowed the state of New York to basically set caps on medical for hospitalization. They rescinded that. And unfortunately, that probably needs to come back. But there is nothing that the city council is going to be able to do that will be able to regulate any prices by any hospital in New York City, never mind New York State. Our objective, he says, is to provide the same health benefits or better for everyone while making long-lasting, sustainable changes to the way they generate healthcare savings and to generate healthcare savings. Do you ever know in your lifetime that you can give up something, pay less for something, and get a better quality of it? It defies logic, right? No one ever says, yes, I have this brand new Rolex watch for you. I'm only going to give it to you for $500. Is that true? No, it's definitely not. It might look like a Rolex. It might say Rolex, but once you peel the back off of it, it's definitely not a Rolex. It's probably not even a Timex. But he's trying to make you believe that they can change the way that they're providing healthcare to you and still save money, and it still be a high quality beneficial plan. And it's not. So one of the things we keep repeating is you keep getting these letters. You got one last October that said that they were going to put copays on Montefiore Hospital, that they pulled Montefiore out of the network. It was no longer a preferred provider. And now any of the doctors that are in that network of Montefiore, you have to pay to see. You had to use a specific radiologist firm. You had to use specific urgent care centers. And if you didn't, you paid more. This is transferring costs to you. I would say that's inefficient for you, the worker and the retiree. But for some reason, the union and the MLC, Municipal Labor Committee, thinks that this is beneficial and that this is a sustainable change to generate healthcare savings. But the savings is coming to save the city, not save you. Labor should not be in bed with management. Hard stop, period. And I keep joking all the time, I'm going to send them all satin sheets for Christmas, because we should be working to make sure that they understand the value of a worker and the value of a retiree. Workers work hard. Labor works hard. We know as city retirees and city employees, we work very hard and we didn't get paid the same amount as our private counterparts. That said, why would you give up something? And why he'll say that generating savings and changing the way that they are providing healthcare benefits is okay. The way that they're doing it is not. And I really don't think you can add something more in healthcare and pay less. That to me is impossible. Now the city will pay less, but guess who pays more? You do. And yet none of you are screaming except retirees. As he goes, at the same time, DC37 continues to fight for more equitable distribution of resources in the delivery of benefits, so our members are treated with the same level of care as any other city employee or retiree. Now, I already made the point over here on the right that by making employees and under 65 retirees pay co-pays and narrowed networks, that's what they've been doing for the last several years, like 20 years, in trying to say that they're saving money. You're actually paying for it. Over to the left, I put another mark here that says your Medicare, the plan that the MLC created was the Medicare Disadvantage Plan, diminished our current health benefit. You see, you guys don't understand what Medicare is because you're not on it. You think all insurance is the same, and it isn't. Medicare is a federal public health benefit, and it is pretty wonderful. It takes care of the first 80% of your healthcare bills, and then the last 20% your city healthcare plan pays. It is the least expensive plan that the city has. Like I said yesterday in the other video, your single plan is about $920 and your family plan is like $2,300. A Medicare eligible person, their plan only pays 20% of their healthcare bills. It's only $200. Hard stop, real cheap. So he's not treating us with the same level of care as any other city employee or retiree. What he's trying to do is diminish our benefits like he's diminishing yours, and we're not going to stand for that. You guys shouldn't have been standing for it either, and we never really understood why you did. But an equitable distribution of resources, the entire city healthcare plan is equitable. It is the city will pay the full cost of health coverage for every employee, retiree, and their dependent. It is equitable. This was the purpose of Administrative Code 12-126, because back in the 60s, before you had this wonderful thing, you had the uniformed forces, ones that had healthcare, not the civilians. So your cops and firefighters would have had healthcare. DC37 wouldn't. This is why this came about. This was important for equity. So then he says, this strategy requires new negotiated healthcare plans for active and retired workers and a new way to administer PICA and other healthcare programs currently funded through the stabilization fund. And so our little snarky comment was maybe not giving the United Federation of Teachers $1 billion might have helped, because that one plan, this one healthcare fund called the Health Insurance Stabilization Fund, is what paid the premium difference, if there ever was a premium difference, between GHI, which is the plan most of you are on, and HIP, which is the city benchmark of the ceiling of what the city has to pay up to. Why would you misuse this fund? Like I said yesterday, doesn't make any sense. So yeah, we've been suggesting that PICA needs to come out of the stabilization fund. It really does need to be put back into the major medical or sold as a separate rider with a small premium on it, spread across everybody. It would definitely help offset it. But you do not implode your healthcare program to finance a drug plan. That to me is absolutely ridiculous, and not just me, to many other people. So going down, he says, this is, we don't generally have any issues with this last paragraph on page 1. To that end, we are now in the midst of selecting a new PPO health plan for active city employees and pre-Medicare retirees and their dependents to begin January 1 of 2024. Now, remember, we've been saying to you for the last year they were going to do this, and we had a really bad feeling that they were coming after us in 2021. They were going to come after you in 2022, and they have. So we don't know what those plans look like. When we hear, I'm sure you'll hear, and hopefully you hear before us. But you should have been part of this process, because this is part of what the union is supposed to be doing for you as an active worker. The city and the MLC started a process last year to procure a new plan covering approximately 750,000 lives, and that would be your active workers and your pre-65 retirees. We received several proposals, and the selection has been narrowed down to 2 finalists. I anticipate the new plan will be announced before the end of summer. We will keep you informed as soon as the process is completed. And when we say another snarky comment, it's funny you didn't tell anyone about the details about the process or ask for any member input, is because you guys should have been informed, or it should have been asked of you, what would you like to see in this? Like, what are you not happy with your current plan today? And if you have the time, I would pick up the phone and call your union and tell them what you don't like about your healthcare plan today, and make sure you tell them what you want to see in this new plan before they sign a contract. Because I will tell you, I don't know if they're going to read the contract, because they didn't read the contract for our plan. It wasn't even published yet, and they still made the decisions on it. So this last section, I'll see if I could do this real quickly. This last paragraph says here, additionally, you may have heard about a series of litigations impacting the implementation of the negotiated Medicare Advantage plan for retired workers. That's for your Medicare people. That would be us. Earlier this month, Judge Lyle Frank issued a preliminary injunction temporarily halting the shift of the new plan. The same day, the Court of Appeals agreed to hear the city's appeal of Judge Frank's March 2022 decision. Now, this is kind of not true, but it's not really major. I mean, he probably didn't look up the dates, or, he just thought they were the same day. But the retiree injunction was granted on July 7th, and that's what stopped the city from trying to force us into one plan and stripping us of all of our choices of healthcare plans and forcing us into one managed care plan, like forcing you into HIP HMO. Now, that was July 7th, and the Court of Appeals accepted the appeal of the city's loss, which was a unanimous loss from 2 courts and 6 judges in June. And I have to keep repeating this. We would not have kept winning if the city and the MLC did not keep breaking the law. The law is the law. The promise was the promise. If they weren't wrong, then the 2 courts and 6 judges wouldn't have found for the retirees. They did, not because they wanted to piss off Henry Garrido. They did because the law had been repeatedly broken. So then he says, the Medicare Advantage Plan program for retirees over the age of 65 is scheduled to start on September 1. No, that's what the injunction did. The injunction stopped that. There is nothing starting on September 1st. And even to prove the same day he wrote this letter, the city of New York wrote a letter to all retirees telling them the plan wasn't going into effect. How did he not know this? This is what tells me he's out of touch. It is unclear how the courts will rule, but in the meantime, DC 37 continues to cover our retirees and their dependents, as we have done from day one. Well, you only cover a premium difference for non-Medicare retirees and their dependents. That's it. Not Medicare retirees. And for everybody, even the Medicare people, the only thing that the union covers is a welfare fund benefit. Medicare people, as we said yesterday, are not covered for premium by the union. The union does not pay for a Medicare person's insurance, ever. He says, it is unclear, DC everything continues to cover. The city is covering the deficit for the current plan through the fund's reserves. And that is for the active workers and pre-Medicare 65 retirees, because they misused the fund. They, being the Municipal Labor Committee, Henry Garrido, Michael Mulgrew, Harry Nispoli, and the city of New York. There is no doubt that this unsustainable stopgap, and we need a more permanent solution. Well, the permanent solution would be to stop misspending the money and stop giving money to Henry Garrido, stop pulling out more money than you need to finance your stabilization, to finance your welfare funds. So what does that mean? There was this pot of cash, like I explained in the previous video, that paid for a premium difference between HIP and GHI for active workers and non-65 retirees. Under 65 retirees. That money's been misspent. We have said this time and time again. The unions have been giving money to the teachers for raises in 2014, $1 billion, $1 billion, billion to the teachers to pay for raises. That fund had one purpose: pay for premium difference between active and non-Medicare retirees. They spent it away. They didn't save their pennies. They weren't fiscally irresponsible. They were fiscally irresponsible. And now the plan had no money. That fund has no money. So the city is absolutely picking up the cost for that. But the unsustainable stopgap and we need a more permanent solution, let's see. The stabilization fund worked very, very well for many years until they misused it. Otherwise, we wouldn't be here. I'm going to stop here. And then I'll start another video starting the rest of the paragraphs because this is long and you can see it takes a lot of explaining. But have a great day.